Good morning, everyone. Welcome to our update on Trinidad and Tobago's response to COVID-19. At the press conference today, we have the Minister of Health, the Honorable Terence Dayal Singh, the Minister of National Security, the Honorable Stuart Young, Dr. Roshan Parasram, Chief Medical Officer, and present with us today is also Mr. Asif Ali, Permanent Secretary, Ministry of Health. I will now hand over the mic to the Minister of National Security. Minister of Health.
Thank you, Minister Cox. Good morning, ladies and gentlemen of the media, and good morning to the listening public as we continue to keep you updated on developments with COVID-19. There has been some significant developments over the past 12 to 15 hours, so we thought it better to have this press conference instead of alerting the public via press release. Before I go into the actual developments over the past 12 to 15 hours, we need to remind ourselves that Trinidad and Tobago is part of a global pandemic. We are one of 100-odd plus countries dealing with this global pandemic of COVID. How have we as a country and as a government been guiding you, the members of the public, through this evolving, emerging, changing situation? Just by way of reminder, the Cabinet took its first major decision way back in January 30th to put a 14-day travel restriction on anyone coming from China, that they must be out of China for at least 14 days before coming into Trinidad and Tobago. We started advising people and the public and the media all through February, both myself, the Minister of National Security, and the Prime Minister. We were advising people all through February and into March to avoid all non-essential travel and to travel for, real emergencies, whether it's by sea or by air. I even advised people that I wouldn't even take the risk of going to Tobago. We took a further decision to suspend the rest of the cruise ship season, which was to end on April 27th. We took that decision. Many of these exhortations on behalf of the government, led by the Prime Minister, were well received in certain quarters. However, as you know, some people, some groups still did not heed the warnings to behave in a particular way. A group of Trinidadians left this country to go on a cruise on the 5th of March. This is after a month of asking people to limit travel. They subsequently became stranded, and as citizens of Trinidad and Tobago, they returned on the 17th of March, 2020, and were taken to a quarantine facility as per protocol. By the 16th of March, they had retained Senior Counsel Ramesh Lawrence Maraj. I just put that out in the public domain. Both the Minister of National Security and myself would have gotten at least 2 letters from Senior Counsel Ramesh Lawrence Maraj, who was retained by these 68 persons who were taken to Balandra. Be that as it may, the health system continued to respond in a most responsible manner, in a most effective manner, in a most humane manner, by providing that facility that was outfitted for them to have as comfortable a stay as possible. On Thursday, the 19th of March, all 68 people were swabbed as per protocol because they fit the definition of who should be swabbed because they were aboard a ship with confirmed COVID-19 patients. We got the results between 9 and 10 p.m. last night on Friday, 19th of March, which was last night. I could tell you that of the 68 people tested, 40 of the 68 have tested positive for COVID-19. 40 of the 68 have been tested for COVID-19. These are the returning citizens who were stranded on that cruise ship. Those are the facts, those are the chronological facts from January 30th to today. I will now hand over to the Chief Medical Officer, who will now tell you how we are responding to that evolving situation as far as the clinical details are important for you to know and for the country to know. Chief Medical Officer.
Good morning, honorable ministers, media, the viewing population, members of the population. So as the minister would have indicated on our normal 10 a.m. release, we would have put out the number of figures, but based on the number of positive we had, we wanted to have the press conference instead. So as of 10 a.m., we would have sent 278 samples to CAFA. You would have recalled that yesterday we would have had 9. We added the 40 to it, so now we have 40. We stand at 49 in terms of our daily count. So just taking you back a bit, yesterday I was asked the question as to what would happen, what is happening with the persons at Balandra. So basically we would have noted that a number of them would have come on with mild symptoms during the course of yesterday and even into the course of the day before. Mild symptoms meaning sore throat. Some of them would have had fever, runny nose, cough, a little bit of lethargy. It is a high-risk population because the majority of them would actually be elderly in nature. So we had planned from the get-go, and because of the risk and the decisions that we have taken with regards to cruise ships, and I just want to put cruise ships in context. Cruise ships are generally areas where we have a great public health risk of spread of infectious disease. So even prior to the restrictions put in place for cruise ships not being allowed to come into Trinidad, the Ministry of Health has not granted pratique, which is the ability for persons to disembark cruise ships from certain territories, going way back into February. So knowing fully well that these people were aboard a cruise ship that had COVID positive people, they would have commingled with these people for well over a month. There's restricted movement aboard a cruise ship, and it is really a breeding ground for infectious disease. We took the decision that as soon as they were landed in Trinidad, they were taken to Balandra. Right after that, as soon as we got our positives, they were taken last night with the help of the Eastern Regional Health Authority, the Defense Force, North Central RHA, and the Ministry of Health straight to the Cuba facility, where all 40 positive people are being housed at this time. They are generally not unwell. They have mild symptoms at this point, but because they belong to a high-risk group, we thought it best that they go to a tertiary care facility. In the event that they develop worse symptoms, they are there already and we can manage them better. So they are all in Cuba. There has been containment from the start. Having 40 cases does not mean that there's any further risk of community transmission to the country. They have been contained from day one. There's no risk, no change of risk between yesterday and today in terms of community spread to the people of Trinidad and Tobago because of the steps we have taken to safeguard you all from the start. So with regards to the 28 negative people, the location has been sanitized completely, and we start over from day one in terms of the quarantine period for today. The PPE as necessary will be worn by all of them, and we will continue to follow their health as they go. If they develop symptoms, they will be tested again, and of course, if, as we expect, more will become positive, we will transfer them to the necessary tertiary or secondary care facility as it progresses. So in the context of population spread, it does not change anything in terms of community spread. The disease is as well contained as it would have been as of yesterday, so there is no further risk to the population. I just want to say that in terms of contact tracing, we have continued our contact tracing across the board. I think there was a little misinformation yesterday that I want to correct, that contact tracing is really done remotely by phone. So we won't have people coming out to your homes to do contact tracing. The only people that will be going out to the homes of quarantined individuals are the district health visitors or surveillance nurses who will be appropriately attired and wearing the necessary badge and identification so that the population can actually know who you are. So I just wanted to start, and we will take the questions later on.
Good morning. Good morning, members of the media, wider viewing and listening public of Trinidad and Tobago. We have always said from inception, when we began having the conversation, the national conversation on COVID-19, then known as coronavirus, that this is a very fluid situation. We are seeing around the world countries, and it is not isolated to Trinidad and Tobago, having to deal with, on an hourly basis, different matters related to COVID-19 coming at them. You've seen in the last 24 hours the government of the United Kingdom taking decisions to shut down their school system, and then last night for them, on Friday, taking a decision to close all bars across the United Kingdom. Anyone who understands the culture of the United Kingdom will understand the far-reaching consequences of such a decision in the United Kingdom. But the United Kingdom took that decision. You've also seen in certain states and certain cities in the United States similar decisions being taken. You have seen a number of countries come after Trinidad and Tobago and have public declarations and decisions that only their nationals could return to their home states. We took that decision earlier than the vast majority of the world. You've seen in the last 48 hours, the United States, Canada, and Mexico take decisions to close off their borders. I say all of this to put into context the global decision-making that is taking place, and where we, Trinidad and Tobago, are doing, as the government, what needs to be done to continue to protect as best as we can the population of Trinidad and Tobago. But the actions are what count at this time. The population would look on, you would hear some very hollow talk by persons, and unfortunately politicians at this stage, saying certain things, but their actions being completely different. At this time, in order to keep the curve down, as you've heard the medical experts say, and we continue on a daily basis, hourly basis, to be receiving the expert advice from the Minister of Health and his staff, the Chief Medical Officer and his staff, and that is what we, the government, are using to make the difficult decisions, but the necessary decisions to protect you, the population, and the public of Trinidad and Tobago. It brings me absolutely no joy to have to address the population this morning on some very irresponsible behavior that has taken place in the last 24 hours by the opposition. The opposition talked a good talk about being socially responsible and about not wanting to cause a sense of panic and not contributing to the whole misinformation that is taking place. But then you had one of their members of parliament calling for, and is being widely reported by the media today, with respect to the closure of bars, you should continue to allow bars open to serve food and for people to come there and buy their drinks. That is nonsensical, and that is why I started off by saying that in countries all around the world, and anyone who's been to the United Kingdom, understanding their culture of the bar system, would understand for them to go to the extent that they have in shutting down all bars, Trinidad and Tobago taking a decision before that, we are more than on the right track. You had state of California declaring a stay-in, everyone stay in their house. So to try and mislead the population and to say that persons want to come to bars to buy food or to buy a drink, you can go to the grocery and buy your drinks and drink it in the safety of your home. The only way we will stop the spread of this virus is by lack of contact and social personal responsibility. And the government took the decisive action to say that we will shut bars. We understand the difficulty that this causes businesses. We are very mindful of that. That came up in our discussions or the deliberations, but it is not business as usual, unfortunately, around the globe. So we have to take these hard decisions to protect the people of Trinidad and Tobago, including the family members of the owners of these establishments. I was a little upset as well to hear, as we were sitting preparing and discussing with the CMO, Minister of Communication, Minister of Health, and the Permanent Secretary before coming to this press conference, we received information that betting shops continue to be open at this time. They fall under the categorization of the clubs. And it's not only about the law. People, it is about your own personal social responsibility. Understand you do not want to draw persons. So we said the casinos, we said nightclubs, we said theaters, and I am proud that we in Trinidad and Tobago took that decision yesterday, because I'm reading now and seeing that there's some countries in the world, for example, the United Kingdom, that are talking about it, and the government is telling them, the owners, prepare, because this is the next step. The only way you beat the curve is by taking these difficult decisions. So I condemn the opposition for continuing along that line, and you, the members of the public, will decide. The government is not doing these things for any other reason than a sense of duty based on the medical expert advice to contain and to do the best that we can to contain this virus from spreading in Trinidad and Tobago. What you're seeing in the biggest economy of the world, the powerhouse of the United States right now, should be a reality check and a wake-up call to the rest of the world. You're seeing certain states, certain cities saying that their medical supplies are under constraint right now. You're seeing doctors saying in the United States that they're reusing PPE equipment. Trinidad and Tobago's government is doing everything we can to prevent us from getting there. And it requires a personal, social responsibility of every person, and that must include the opposition and the politicians there. You then had a case that you heard the Minister of Health refer to a short while ago. Well, actually, this is another one. There are persons who are stranded right now in other countries, for example, Margarita, Venezuela. I'm getting messages about Guyana. But that is because those countries, those sovereign states, have taken this decision to protect their countries and their people by shutting down their airports. There is nothing that Trinidad and Tobago can do or would try to do to persuade another sovereign state to open their airport. If they take a decision to close their airport, that is their decision, and that is why I referred to, if you can understand Canada and the United States closing their border, what that means. The United States closing its border with Mexico, what that means. As of today, Guyana, Venezuela, Argentina, Colombia have shut down their borders, have closed their international airports. So to have the leader of the opposition say something as irresponsible as send a plane to bring home people, it shows, as I said, it is not about talk, it is about the actions. Of course, we would love for every national and citizen of Trinidad and Tobago to be here in the safe confines of Trinidad and Tobago. But as every country takes a decision, that is a decision to not only protect their country, but to protect the globe. This virus, as we've been hearing, as we've been seeing, spreads by contact. So we denounce these very irresponsible acts and the continuation by the opposition to create a sense of fear, a sense of misinformation, and to mislead the population. The government is very mindful of what is going on. I was told by our embassy in Caracas they've been in touch with the persons in Margarita. They're making arrangements as best as can be. This is not confined to us alone. And the United States, with all of their military planes that they can fly into anywhere in the world, have not taken those types of decisions for their citizens who are stuck in countries that have closed their borders and closed their international airports. This virus spreads by contact. And anyone who doesn't understand that at this stage has a serious problem. And that is not a message to the population. That is a message to the politicians. Stop politicking. The government took decisions, and these decisions are in furtherance of how we protect and secure the people of Trinidad and Tobago. Right? We understand that there will be job loss. But as the Honorable Prime Minister said in a conversation with me a short while ago, we are the ones who must take these hard and difficult decisions. Job loss for a temporary time versus loss of life. Because that is what the lack of containment of the virus can mean. We recognize the difficulties that people are going to face personally. But the public interest and the balancing exercise is about protection of life. Having said all of that, The government has taken a decision, and I'm announcing it now, that as of midnight tomorrow night, we will be closing off our borders completely. So as of midnight tomorrow night, Sunday, 22nd of March, we will no longer be allowing international flights into Trinidad and Tobago. We will be closing our borders. We will, of course, continue to allow, under the restrictions that we have currently, the cargo vessels to come to Trinidad and Tobago. We have put protocols in place to deal with that. The global pharmaceuticals, food, supplies continue to come to Trinidad and Tobago. We have our protocols in place. That is working very well. We're not allowing the crews to disembark. I have been in constant discussions with our major energy companies over the last 5 days, and we're facilitating them continuing in a safe manner the continuation of their operations. They have been acting responsibly. I'd like to thank them. I'd also like to thank all of our frontline workers, in particular the health workers, who are doing a tremendous job. Our services or law enforcement services. I had a meeting yesterday with the Trinidad and Tobago Police Service and the Defense Force, which leads me to another point. The government has been pleading with the population to listen to our advice, listen to the advice of our experts, and to self-discipline, to be socially responsible. There are still some elements that refuse to take on and heed this advice, and that is what puts the rest of the population at risk in the spread of this virus. We will enforce the law. So anybody who has misread the government to say that we will not enforce the law, and in particular the regulations that were passed between yesterday and today to close down bars, in-house dining at restaurants, clubs, and what was the other category? And cinemas, we will enforce the law. But of course, we're asking people to take the decisions yourself and to be responsible. We, to just finish off one of the points Minister Dayal Singh made, from a very early stage in how we were handling COVID-19, we cancelled all government travel, all non-essential emergency travel. At the cabinet level, we took that decision in our various ministries. We stopped approving any travelling. And that is what we've been asking people to do. But now the government has taken the decision to protect the people in Trinidad and Tobago. As of midnight tomorrow night, we will no longer, until further notice, be accepting international flights and international travel into Trinidad and Tobago, whether you're national or non-national or not. This is constantly being analyze, and we continue to look at it, and we'll continue to be guided by our health experts, and we will at the appropriate time make the necessary announcements if it has to be adjusted, as it will when we get over this. But we will only get over this if we all work together and do what we as the individuals have to do for our brothers, as being our brother and sisters keepers. Thank you.
Thank you, Minister of Security. Thank you, Minister of National Security. Minister of Health.
Thank you. I just want to go to some other issues now that we have digested the information that 40 of our nationals have tested positive. I want to tell the national community to look around the world and see how health systems around the world are collapsing one by one. People in countries that are much more developed than us, with much bigger budgets, that are much more sophisticated, their health systems are collapsing. I say this because we have been able to treat with this COVID-19 response with these 68 nationals and 40 positive tests, in addition to the 9, so we now have 49, with absolutely no interruption of delivery of services at our hospital and healthcare network. Those gains are hard-won and hard-fought. But it could all collapse tomorrow if certain members of the public and certain groups continue to behave irresponsibly. This is a hard-fought gain, that our healthcare system continues uninterrupted. But it could collapse if that same church in central Trinidad continues to behave irresponsibly. Because what you will get is community spread, and thousands of people will descend upon your healthcare system. We do not want to reach there. So I am appealing to bar owners, betting shop people, everyone where people can congregate. Now is the time to put aside sectoral interests, as we have been saying all along, and protect not only yourself but your country. Trinidad and Tobago is looking upon everybody now, 1.3, 1.4 million people, to behave responsibly. And in that light, I want to thank again healthcare workers who are actually volunteering to go into Balandra. What we have done at the Ministry of Health now, in an effort to protect our healthcare workers, our nurses, our doctors, wards maids, at the front line, we'll be expanding COVID-19 testing for them as a special population. We must protect them, and we care about them. In an effort to eliminate burnout, and we are not even there yet, as other countries are. You are seeing they are burning out. We don't want our healthcare workers to burn out. In an effort to ensure we are well manned and we are well staffed, the IDB has agreed to fund, with almost immediate effect, 100 house officers, which will be primarily deployed in North Central Regional Health Authority, because that is the authority that Couva Hospital and Cora falls under. So we are going to be bringing on stream in a phased basis 100 house officers to backfill the system, to free up consultants, to free up senior doctors. We'll also be bringing in more nursing staffing, again being paid for by the IDB. So we don't want the healthcare system to be overwhelmed. We are not there yet. We are not near there yet, but we are planning. But I need the population to heed the warnings of the Honorable Prime Minister, Minister of National Security, Chief Medical Officer, and myself. We need everyone to do what is right for you, because as a young person, you may not feel the effects of the virus. But if you behave irresponsibly, you take it home to granny. You take it home to your grandfather and your parents, and they will pay the price for your irresponsibility as a young person. I want to announce this morning the following. The hotline is up and running, but the hotline is to be reserved for questions dealing with COVID-19 only. We have a series of other measures that we have put out. Full-page ads that give you information. We have social media. We have our website. Please go to these alternate modes of communication before going to the COVID-19 hotline, because all hotlines around the world are collapsing. We don't want that to happen here. So the hotline is 877-WELL. Let me repeat it, 877-WELL. But that should be your last resort for COVID-19 questions only. If you have a medical emergency, the regular 811 is there for you to take you to a hospital. So we have our hotline platform. We have our printed platform. We started, I think, last weekend with full, center page spreads. Use these as your screening tools. We have social media. We have the Ministry of Health website as your screening tools, with all Instagram, Facebook, Twitter. We have all these forms of communication to give you screening information, and the 877-WELL hotline should be your last resort for COVID-19 questions only. I am asking, and the Ministry of Communications also has a whole communication platform to deal with these issues. I just want to say before I leave, as we manage this evolving situation, we are in a good place. But all that could amount to nothing tomorrow in a flash if we behave irresponsibly. So my last call echoing the Honorable Prime Minister, the Minister of National Security, the Chief Medical Officer, and every healthcare professional we have put out there, Dr. Trotman, Dr. Othello, Dr. Nandram, please follow the common sense measures, and I promise the country, if we are all responsible, we will come out of this stronger and better. Thank you very much.
Thank you very much. Okay, Minister of National Security.
Thank you very much, Minister Cox. It never ceases to amaze me after we make some announcements how people then try to interpret it in different ways. So for clarity, I thought I was very clear. From tomorrow night at midnight, Sunday night, the 22nd at midnight, we will no longer be allowing people into our borders, whether you are non-national, which already exist, or a national of Trinidad and Tobago, right? Airports and seaports. We are closing our borders until further notice. So we are not allowing, as both the CMO and the Minister of Health are pointing out to me, we had already decided, for example, as we know them, yachties, if you are non-nationals, you are not being allowed in Trinidad and Tobago when we took that decision. But from midnight tomorrow, we are closing our borders and we will no longer be allowing nationals or non-nationals in as a temporary measure assisting us in the fight against COVID-19. And this decision was taken on very clear medical advice given to us. All of our decisions are being taken with the input of the medical advice. I hope that is very clear now. Thank you.
Okay, ladies and gentlemen, we are open for questions.
Good morning, folks. Akash Samaru, CNC3 News. Dr. Parasram, last Thursday you mentioned that 66 people would have been in contact with one of our, at that time, 9 confirmed cases. Can you give us an update on if those 66 people were tested and what were those results?
Right. So what I did is I gave an example of the possible contacts with one particular case. So when we speak of contacts, we think of primary contacts who are the greatest risk. So those are your immediate contacts like your family, your relatives that actually stay in a house with you. There's secondary contacts, which basically are contacts of the primary people, and there are tertiary contacts, and it goes on and on. So the risk as you go from primary to secondary to tertiary actually gets less of you contracting the disease. So all contact tracing has been initiated for all our 9 cases, for primary, secondary, and in the case tertiary as well, and they have all been advised to self-quarantine. And I think the point needs to be made that people need to heed the advice and stay self-quarantine when you tell you. It doesn't mean that you can, as a family, once you live as a family in close contact, all of you are at risk. So if you quarantine a parent that may have been exposed, it means that everyone in that household should be quarantined as well. It doesn't mean that the other 3 persons can move freely about and go on and on, which has been happening. So we would, yeah.
So just to clarify, those 66 people you mentioned were a part of the number that you got from the contact tracing from one person.
From one particular individual.
And those people have been advised to self-quarantine, and that's where we are right now?
Yes.
Okay, so we haven't reached the stage where symptoms were developed and any testing?
No, and as soon as symptoms develop in any one of them, we are testing them and we are waiting the results.
I know there were mechanisms to make sure those people stay in self-isolation.
Sure, and we would have sent out a press release indicating that we are teaming up with the TTPS in light that people are not heeding the warning regarding self-quarantine, and we will take very stringent measures under the Quarantine Act and the Public Health Ordinance if people continue to break the self-quarantine.
Minister of National Security, you mentioned closing off all borders by March 22nd. Is there any plan to step up the patrols for some known areas for illegal entry?
As I've said repeatedly before, yes, and those are being implemented. Fortunately and unfortunately, we are an island, and that means that you have a 360-degree water border. So weeks ago, we are utilizing our assets, including our air assets, to do more patrols. We also have on-land patrols. I don't want to get into the specifics of those because, of course, it begins to defeat the purpose. But all of our available national security assets for maritime border patrol are being utilized.
Minister National Security, could you clarify the point concerning cargo?
Yes. As I said a short while ago, We continue to allow international cargo into Trinidad and Tobago. We have protocols in place, policies in place, procedures in place. We continue to allow cargo vessels, including the cargo vessels from other CARICOM islands that would be bringing their produce and ground provisions and these types of things to the CARICOM jetty on the Port of Spain wharf. We have protocols in place where the crew on all of these vessels will not be allowed to disembark, and we have protocols and procedures in place where we take the cargo off of the vessels onto the port side in Trinidad and Tobago, and we're able to then continue operating. So the ban does not include the cargo vessels. All cargo vessels. It's not only grocery supplies and pharmaceuticals, because we recognize that there are other operating and logistical things for other businesses. So right now, all cargo ships. This is the current measure.
Good day. Sit on. Hi, good day. Renuka Singh from the Trinidad Guardian. Minister Dayal Singh, with this jump from 9 to 40, are our hospitals still able to deal with the massive jump, or are there contingency plans to bring in outfits for the ICU beds or ventilators to deal with it?
So, as I said, our current hospital system operates unabated. That goes on. We have identified Cora as a secondary facility for a certain level of care, and Couva for tertiary care, which is more for ICU capability and so on. So all 40 of these people they were moved to Couva, I think 1 o'clock this morning. So they were moved to Couva 1 o'clock this morning, and they are under care there. So because of that, our regular hospital system goes on as normal.
And also, you mentioned that you received a legal letter from Ramesh Lawrence Maraj. Could you give us some indication of what that letter said?
I would not. I will leave that for the Attorney General to respond to Mr. Lawrence Maraj.
Good morning, Karen Kozer, Philip TTT News. Just to confirm now, that's 41 people in Couva, including the first patient, and it's been some time since he's been there. Can you give us an update on his health or her health?
Yeah, I have to get the actual number of people split between Cora and Couva. I think it's more than 41. It may be 42 or 43. But we would have said in our press release yesterday, no one has deteriorated of the original 9, and some of them are actually on the way to discharge soon. We have to follow our discharge protocols, which includes getting a negative swab before you're allowed to leave. But a lot of the 9 actually are in very mild states at this point.
Okay, and the shutting down of the borders, does not include inter-island travel, does it?
Thank you for that question, Karen. I was just being asked a similar question. At this stage, we are continuing with our domestic flight arrangements. I am in discussions with Caribbean Airlines. There will be, I suspect, changes based on the medical advice we've been listening to of social responsibility, social distancing, but we're leaving CAL at this time to work these logistics out. I just want to put on record one of the factors that was taken into consideration by the Cabinet Committee in taking the decision to close our borders. Based on the medical advice of the Chief Medical Officer and his team to CAL, they had started asking Caribbean Airlines to quarantine crews that were going out on international travel, which made absolute logical sense. What that then began to mean for the airline, you can well imagine. And then looking at what is happening around the world, the decision was taken, and another decisive decision that I'm proud to be part of, to protect Trinidad and Tobago, and to take this decision to shut down all international travel and international maritime coming in, save for cargo ships. So right now the domestic travel will go, the flights between Trinidad and Tobago will continue, but subject to review by CAL. The Minister of Works and Transport was looking at, and I'm sure by now they've worked it out, the protocols that would apply for the ferry service, because obviously on the ferry there's a lot more room for social distancing on the ferry. So for example, if there are 400 seats on the ferry, they will take decisions based on the advice of the medical experts as to how many they should board. Now again, as we were discussing this morning on another issue that will come up in the next few days, if you're social distancing and we say 400 people on a ferry and you need to have, let's say 150, it doesn't mean the 150 go and sit down next to each other, spread out, because I mean these are some of the things you're seeing people do.
On the issue of domestic travel, Karen, because you raise a good point, the Ministry of Works and Transport was advised some time ago, and the Minister of Works and Transport answered a question in the Parliament. We are asking maxi taxi drivers and taxi drivers, if you have to transport people, do so without air conditioning and open your windows. Fresh circulating air in a maxi taxi is better at preventing community spread than air conditioning, because in a maxi taxi where you have 12 people or 25 people in close quarters, you need that fresh air. And I drew the analogy to Cora, where we treat TB. Cora is not air conditioned. You have cross ventilation, and that works beautifully for infectious diseases spread by coughing or sneezing. So again, we are appealing to maxi taxi drivers, especially because if you make 10 trips a day, that is 250 people you could positively impact on. So open your windows, take off your air conditioning, and that's a good common sense public health measure we could implement, without having the force of law.
But the close contact in the maxi taxi is still going on. 25 people in a maxi taxi, 12 people in a maxi taxi.
Yeah.
So how do we get them to practice the social
That's
distancing?
another story. Again, only travel on a maxi taxi for essential reasons. If you're traveling on a maxi to go to a line, don't do it. Only if you have to go to your job, whatever. But to go on a line or a social event, don't do it. We are asking people to be responsible.
Okay, this is a question for Dr. Parasram. This came from online. Persons are asking the persons who tested negative and are in quarantine from the 68, how soon will they be released? And because they are thinking about the possible community spread.
Sure. So they, as I said before, their quarantine period restarts from day one. So that will go for 14 days in the first instance from today. Right, so that will go 14 days again, because we would have considered exposure to a positive person as having been prior to today. If anybody else from the 28 develops symptoms, unfortunately, we may have to restart it again. But we're trying to isolate them as best as we can to keep the negative persons negative. So we have to monitor it on a daily basis. If symptoms develop, we will continue to test.
Just before we go to, sorry. So I'm now being asked to clarify with respect to cargo planes. So the answer is yes, cargo planes like cargo ships, maritime ships, would be allowed to land. I was having that discussion yesterday with Caribbean Airlines, and it's not restricted alone to Caribbean Airlines. We are going to put in place the necessary protocols and procedures to deal with air freight coming in and air cargo coming in as well. Thank you.
Renassa Cutting, TV6 News. What measures are being taken where it concerns the healthcare workers attending to these confirmed cases? Are they also under measure of isolation or quarantine, or are they returning home to their families?
No, so they all, first of all, they are wearing the appropriate PPE, which decreases their risk of getting infected. The other part of it is exposure is the important factor, so we're decreasing the risk of exposure. And they will have to undergo a period of quarantine as well, because a lot of them has indicated to me actually that they're willing to work, but they don't want to expose their own families. So we are putting measures in place so that if they come off a shift, they have somewhere to be. For the quarantine period, even if they can stay apart from their families, we will look for signs and symptoms. Of course, if they develop it, we will be ready to test and then make a diagnosis.
To the Minister of Health, where it concerns pandemic leave, we've had a number of persons from both the public and private sector indicating to us that their employers are telling them they are not able to honor their requests because they have not received anything in writing. So exactly how is this supposed to work?
That's not a health question. I'll let the Minister of National Security deal with that.
All right, that is actually one of the issues you all would have heard Minister Baptiste Primus and her committee talk about last week. I believe it was Sunday. The policy document has come before Cabinet. It has been sent to Finance and General Purposes Committee, which will be meeting on Monday morning. We will take some decisions, or we'll give it consideration then, and you could expect further announcements by the government coming out of that, our deliberations and the decisions, the final decisions to be taken by the Cabinet.
Government also would have legislated some restrictions on the operations of these cinemas, bars, etc. What about malls, shopping centers?
So at this stage, no decision has been taken via legislation to shut down malls and shopping centers. Remember, you still want persons, once they're operating within social responsibility and performing social distancing, to be able to go and get the supplies they need. This is not an excuse for people to go and congregate in malls and do as Trinidadians we may do on Lime, etc. Go out, leave your house, get what you need to get, knowing beforehand where you're going, get it and come back in your home. We have not taken any decision to shut these down, but the government has said we don't want social gatherings and congregations of more than 10 persons. Yesterday, when I was meeting with the Defence Force and the Police Service, the issue of funerals came up. You've heard the Minister of Health address that previously. And we need to be innovative. So one of the members who was around the table said he had buried his brother-in-law yesterday morning, and they streamed the service online via YouTube so that the other family members and friends who wanted, these are some of the things we need to do in these very different and unusual times.
Good morning, Jensen Levin from the Newsday. I have two questions. One is a four-part question. So I'll ask you the one-part question first, and that's to the Minister of Health. The USA, I think it was Thursday, approved a drug to treat with COVID-19. Have we considered using that?
So I have asked the Dean of the Faculty of Medical Sciences to look at not a particular drug, but any treatment that has been used and borne any success across the globe, and make a recommendation to the Ministry of Health, to my office, as to which ones can be used. I don't think that anyone has come out definitively and said that there was complete success with any one treatment. So the team of experts from UWI will be looking at it. Last night he sent me a terms of reference for the committee. He is setting it up very quickly, and they will begin looking at it in short order.
Let me just say, from a policy perspective, and this is where I as Minister of Health will come in. From a policy perspective, there has been no drug that has been shown to be effective against COVID-19. What you have is some anecdotal evidence. At the start of this pandemic, there was a combination of two HIV drugs, because it's a viral drug and antiviral drug. The latest research says that that has proven to be totally ineffective. So we have to be careful when we import news from abroad, latching on to a silver bullet. There is no silver bullet as yet. The only silver bullet is societal responsibility at this point in time. That is the silver bullet. That is the vaccine. The vaccine at this point in time is not one you shoot into your arm. The vaccine is for people to work with the government, heed the Prime Minister's calls for responsibility. That is what will get us through. And I'm asking all, and this is not an attack on any bar owner, any religious thing. All bar owners, all religious institutions have a role to play. Pray to God. I am asking the country, we need prayers. Let us pray to God as we have never prayed before. But you could do that in the comfort and confines of your house. You could look at your religious shows on TV, whether it's Hinduism, Islam, Christianity. Continue your religious practices, as I said yesterday. If you have to go to the river for shaving, go. Be faithful to your faith, but only go with 10 people. That's what we are asking to do. So I don't want, you see, once we start this talk about a miracle drug or a miracle cure, it sends a message to the population that I could just pop a pill and it will cure me. No, there is no confirmed peer-reviewed drug that I, as Minister of Health at this point in time, could tell the country it will cure you. None. What will cure you and what is the vaccine is self-responsibility, social responsibility.
And now for my second question. This is my second question, just 4 parts. All right. Doug, could you give us the doubling rate that TNT is using as doubling rate that Trinidad and Tobago is using? Based on that doubling rate, the percentage of people that you expect to contract the COVID-19. I know this one may be a bit morbid, but any calculations in terms of anticipation for mortality, the mortality rate? And the last one is, given the influx of Venezuelans, what figure are we using, 1.4, 1.4 something, in terms of population size?
So I, as Minister of Health, will deal with some policy issues before Dr. Parasram talks about Dublin rates and so on. We had a meeting yesterday with PAHO. PAHO has already begun and in the process of doing just that, plugging in certain country characteristics into a modeling process. However, again, these will just give you estimates because this thing changes. So any estimate you do today could be null and void tomorrow. So we are doing it. You asked about death rates. So before I go to the Chief Medical Officer to talk about that, the average death rate around the world that policymakers look at is currently 2.4%. But that varies from country to country. But the average, taking a country with the highest to a country with the lowest, is currently 2.4%. Okay? And the Venezuelan question, Minister of National Security will answer that. But let's go to the Chief Medical Officer now.
So I don't know if there's anything left to say. No, I mean, to be honest, we can't answer those questions in finite terms at this point. As he said, PAHO is using a model, various models. So there's various models, and the models are dependent on the infectivity rate in your country, your case reproductive rate, meaning the propensity for the virus to spread from one area to the next. It will change based on climate. It will change based on the density of your population. It will change based on sometimes even ethnicity of your population. So there's too many factors to actually pin down an actual number that we are expecting to see. What we are trying to do is minimize the actual number, contain those numbers. So far the number is 9 beyond the 40 cases that are hospitalized. The 9 cases, do our contact tracing as best as we can, lock down anybody that has been in contact. And again, if they develop symptoms, we test and we start our, once we are able to do that successfully, repeatedly, we can contain it. And that's the standard we are going for. So we're trying to keep the numbers as small as possible, looking on as to what has happened in other territories when you have gone to community spread. PAHO will put in their numbers, they will develop scenarios, there will be A, B, C, D, E scenario as they change the different variables that go with the, it is really something that they do, they put it into a statistical mapping program. So the variables will change and you'll have 5 different models of possible spread. None of them may be accurate. So we have to base it what we have on the ground. We deal with the cases that we know, the cases that we can trace, and we lock down as many of them as possible.
The most recent figures that we have now.
So the most recent figures, again, aside from the 40 that we said, the number stands at 9 positives, and we have contact traced all of those 9. So there's no doubling rate for it. We have something called the case reproductive rate, which means that the ability from the virus to spread from one individual to the next, right? So for something, generally speaking, if you have a case reproductive rate of 1 or less, it means that the virus can only spread between me and my close contacts, which is my primary contact, my people who are very close contacts. For this virus, it seems to be, and again, the data is changing every day because this is a new virus. So people are saying around 2, which means that, and that's why we have been saying social distancing 6 feet apart, because if you are that distance apart, chances are you're not going to get spread from somebody that is positive. So all the public health measures and the social distancing measures are based on the propensity for the virus to spread from one person to the next. For this virus, it has been said that for one person infected in a group of 10, another person or 2 other people in that group in close contact for any duration of time will get it. Some other viruses like Ebola, if we had a small group in contact with an ill person, you would look at 6 or 7 people in that small group of 10 to give you an average of how it goes. Influenza is probably 1 in 10. So you can gauge it based on those things. All right?
Final question.
Oh, okay. Minister, National Security, now that the borders have been completely closed off,
Akash, from midnight tomorrow night.
now that you made the announcement that that's going to happen, so it's going to happen?
Yes,
right.
it is.
Okay, great. Any consideration into extending the immigration permits, that initiative that took place mid last year, that was supposed to expire 1 year later? Any decision about that? Registration, of Venezuelans.
The registration of Venezuelans has absolutely no correlation with persons coming in. By definition, they're already here. But as I said a year ago, that is something that we continue to review. Decisions need to be taken with respect to the extension of these registrations.
I'm asking if they're here, they can't go back even if the permit expires.
If they want to go back, yes, they could go back, but they wouldn't be able to get into Venezuela because Venezuela's borders are closed. We're not preventing people from leaving, we are preventing people from coming in. With the Venezuelan registration system and the cards, it hasn't as yet come up. The year hasn't come up, so there's still time. We're reviewing it, and we will take the appropriate decisions.
Right. If I may have missed this, but did you give a date? You said when you're on 22nd, when you're going to close off the borders, until any particular date, or that remains open?
As I said, okay, let me clarify what I thought was clear. The government has taken a decision that from midnight tomorrow night, because someone was just asking me when I say Sunday midnight, does that mean from midnight tonight? No, it is midnight tomorrow night. We are closing our borders. We're not allowing nationals or non-nationals in, save for the cargo ships and the cargo planes that will come in and bring in supplies. So what is the clarity, the further clarity you'd like with respect to that? That is until further notice.
Until further notice.
Correct. Because as we've said throughout, Trinidad and Tobago, you all would see, and it's happening around the globe, one thing this government is not going to be guilty of is pinning and fixing ourselves on any position. You're seeing that happen in other jurisdictions, and they have to come back the next day and change it. We continue to be guided by our medical experts, so at this stage, we are going to shut our borders from midnight tomorrow night until further notice. Let us hope globally something great takes place. If it doesn't take place, we will continue to do what needs to be done, and exactly as we've been doing on an almost daily basis, we will make the announcements to the population.
Minister Delsing, what's the capacity of the hotline to accept these calls now that it's up? How many people do we have manning those hotlines?
Yeah. So currently, we have hired 10 doctors who have been trained to man the hotlines. We didn't use civilians because the population will ask medical questions. So we went through a whole questionnaire training process with them, and we have 10 people. So it's up and running, but I want to reiterate the point, Akash. The COVID-19 hotline is the last resort, because what is happening around the world, all the hotlines are crashing under the sheer volume of calls. I am urging the population to, again, pay attention to our media advertisements. This will give you a lot of information. So don't call the hotline for basic information, which we have put out into the public domain. We have our Twitter platform, our Facebook platform, Instagram platform, our Facebook pages, Ministry of Communications. All of that is first, second, third, fourth, fifth line of communications before you call the hotline, because I know as soon as you all leave here, you all are going to call the hotline to test it. We don't want to clog up the hotline with unnecessary calls. These are 10 doctors that are being paid for to treat with persons especially elderly who may not know how to use social media. Let's reserve the hotline for those persons who don't have access to a newspaper, Twitter, Instagram, Facebook, Ministry of Communications. And believe me, I will be the first to know if something goes wrong, and we will put measures in place to fix it. So
Okay, we have some final words from Dr. Parasram, please.
Yeah, although the restriction comes into place on the 22nd midnight, I just want to say we have been getting some reports of persons coming through our borders, traveling to other parts of the world, and they are not heeding the cry to self-quarantine. Everyone that comes through from an international site at this point, from now until we close the borders, and even for the last 14 days, should be home quarantined. If you get symptoms, now that we have the hotline up, you can call us and we will test you right away. If you don't heed your quarantine, you're putting all of us, your families, at risk. People have been coming home from other countries of the world, going to parties and doing the irresponsible thing. So the borders are open up to midnight tomorrow night, but in that intermingling period, you should behave as if you are self-quarantined. Everyone that comes in, it should be under self-quarantine. My port health officers will be issuing a quarantine form to you all and letting you all know how to self-quarantine. If you have any concerns, you can call the hotline. But please, everyone needs to be self-quarantined who has come into this country over the last 14 days. And if you develop symptoms, let us know right away.
Final words from the Minister of National Security.
Thank you, Minister Cox. She was just teasing me when I intervened. That is the second final words. It has just come to my attention that unfortunately there continues to be a level of irresponsible behavior, and on this instance by, I guess, members of the clergy, persons who are pastors out there, and they're still calling on their worshippers, persons who worship in their churches, to come and to gather because God would protect them from the coronavirus and from COVID-19. I just want to remind people of one example of how that type of behavior led to a run in a country. Go and research South Korea and go and see what was the start of the spread of coronavirus, COVID-19, in South Korea, and it was a religious gathering and at a church. So whilst we all believe in God and that God has the ultimate amount of power and strength, this is an extremely irresponsible call. Yesterday, the Trinidad and Tobago Police Service brought to my attention that there continue to be some religious establishments in central Trinidad that are still having gatherings. The Minister of Health referred to it. But now to be told that there's a certain pastor who is still calling on his followers to come and to gather because God would protect, quite simply, from a medical point of view, unfortunately, that is simply not true. And we will now do a consultation and we will take the necessary actions. As we've said consistently, the government is going to take whatever action it needs to protect the citizens and the population of Trinidad and Tobago. So we will focus on this. But in the meantime and in the interim, until we do what needs to be done, maybe from a legislative point of view, please, everyone, act responsibly, including the persons who lead these churches and lead these religious bodies. Do not have social gatherings of more than 10. That applies to you. Thank you very much.
Thank you very much, ladies and gentlemen.